Right, well, thanks, Mark, again for coming back to us. I know it's only last week that we did an initial podcast, and really this is an update, and it needs to be really focused, Mark. We said we'd probably come back this week about, I want us to focus, if it's okay with you, Mark, on specific advice to our patient population. And a bit of that advice, I think, just to start with, a bit, and I think it's a bit of good news, is the need for our patients to ensure that they're fully vaccinated, their friends and family. And this weekend, we've seen a significant uptake in the vaccine clinic. I know I did a pop-up vaccine clinic in Sheffield bus station, and it wasn't half cold. There was bits of me that are still defrosting. They really shouldn't have frozen in the first place, but it was really good to be engaging 250 people in 5 hours turned up for a vaccine. And I think you've been doing very similar sort of work down in Patworth.
That's right. I take it you had a hat on then to cover that vulnerable head of yours, yeah?
No, I did have that bit covered. It was the other bits that I should have covered more carefully. Anyway.
So the weekend I was on call, and Patworth has set up a pop-up clinic, and we've battered through several thousand people, and so I was tweeting about it and getting a lot of really positive engagement. And I guess it's a good place to start, because I know we talked about it last week, but it's important that everybody's clear that getting a booster is the most important thing right now. So I don't expect that many, if any, of the pulmonary hypertension patients watching this won't have had a booster, but it's worth encouraging your friends and your family or the people you're in contact with to do the same, because we accumulate risk from the people around about us. It's not just about the individual, it's about the community. And
I think one of the things that has changed very recently, Mark, with the increased vaccine activity is as we've talked about, pop-up clinics where you can just walk in. So sometimes I think we can easily put down, I've got to book in and turn up, but literally to walk in and get your vaccine done, it's very safe. It's a real positive.
Yeah, it's been a real frustration actually over the summer, because I think one of the things that the system didn't have institutional memory of about the successful first drive was it was really flexible. And so in fact, I've been complaining, in print and social media about the inflexibility of the system as it evolved over the summer. And so that's all been swept away again. And in fact, we saw record numbers over the weekend ever vaccinated in the UK, which when you think about what an amazing drive we did first time round, the fact that we're knocking out 1 million a day at the moment is just phenomenal.
Good. So being very specific, Mark. So we're speaking on the 20th of December. So this run up to the sort of Christmas New Year period, and where we're at. Advice specifically for our patients. We know the government might come up with a press conference this evening, tomorrow, and things might change. From your perspective as an expert in pulmonary hypertension and vaccine and things, what do you want us to ensure our membership and our patients actually hear at this stage?
So I think that our patients just need to get through this next 6 to 8 week period without having got Omicron. That's the kind of really critical bit. And so last week we talked about thinking very carefully about your social interactions. We talked about minimizing them in the acknowledgement that life is complex and we all still need to live. And I think that message is still there, but maybe just a little bit more muscular, a wee bit more firm. You really want to avoid this wave in over the Christmas and New Year period, and it will be a wave, because we know that's the traditional kinetics of the virus as it goes along. There will be better times, but it is important that they think very, very carefully about risk and about how their own behaviours and how their own interactions modify and change that risk.
So, I asked you to be really specific, Mark, and I know this part is your opinion based on your clinical expertise, but over the Christmas period, gatherings, what would you class as an unsafe gathering for somebody with pulmonary hypertension or on the peripheries? What's unsafe, do you think?
Good question. So the first thing is, are the people you're visiting both vaccinated and boosted? Because we know vaccinated now isn't enough. You need to be boosted to have that appropriate level of protection. We don't know what that does to transmission, but at least it ensures you're starting from as high a base as you can. Have your lateral flowed, and I think that's a really important thing to be embedding into your practice when you're interacting with others right now at the moment. It doesn't prevent you from passing the virus on or from picking the virus up, but again, it just weeds out more people who are positive. So we know that positive lateral flows are pretty good and pretty diagnostic. We know that negatives are not definitively negative, but at least if someone is known to be positive, then you can avoid interacting with them. And then lastly, it's really thinking carefully about how many people you're going to visit and how many people you're going to socialize with over the Christmas period. And it's something that I think came up last time we talked about it, and I used the example of me thinking about visiting my vulnerable dad, and I still haven't come to a definitive conclusion on that one, but we've agreed that the previous plan to fly up is a no, is an absolute no. We've all been tested at some point this week. We'll continue to test. We'll see what happens round about us, and we'll make a decision, I guess, quite close to the time. But the calculus of it is, against going.
Yeah. Just that's one reason, because the first thing, let's get vaccinated. Lateral flow testing really good. The other really common things, and you really emphasised this last week, Mark, about doing the things that we know we should be doing. Mask wearing, and I was on Saturday. I went to Meadowhall Shopping Centre in Sheffield, and I was really surprised. About 30% of people weren't wearing any masks at all. But there's a real mix match of what is a mask and what is not a mask. I know we're going to real basics, but could you just say something about mask wearing?
Okay, so I'm going to deviate a little bit from the party line in this one. So I'm going to go a little bit off piste. From the beginning of the pandemic, my expectation was always going to be that higher grade masks are better than lower grade masks. It just kind of makes sense. It's a respiratory virus that's passed on by airborne, whether you say a mixture of droplets or whether genuinely more complicated airborne transmission. We know it's airborne, and we know that FFP2s and FFP3s offer a higher likely protection than certainly cloth masks and surgical masks. So I think again here it's about understanding your own risk and having a think about how you want to approach risk. And I'm at the moment wearing FFP2s and FFP3s. They're not particularly expensive. They are in other countries, lots of other countries, pretty standard actually. And I'm wearing them when I'm in high risk areas. If I'm just out and about in the supermarket, for example, I'm still quite comfortable in a surgical mask because that's a relatively low risk place. But if I'm in a situation that I deem higher risk, then I'm putting on a better quality mask. And so that's not quite in line with the guidance. And a number of us for quite a long time have been kind of a wee bit less on script with that. But I think for my patients, I think that's a reasonable bit of advice. And although it's not perfectly in line with what the kind of authorities have been telling us, I think it's better in line with the evidence and certainly with some of the kind of common sense considerations about what constitutes protection.
Good, that's helpful. Just going back, I'm going to jump back a little bit, Mark, to sort of being safe and things like that. Obviously, in this next 6 to 8 weeks, as we talked about, it's going to be a bit of a rocky road and being really sort of cautious about things. One of the challenges people with PH have is their health and well-being can change quite dramatically. And we talked about this in the first phase of the pandemic about seeking help. Again, be really cautious, but what about if you're not feeling well? What, again, from a PH perspective as a medic, what would you be saying to people that we look after on a day-by-day basis? Okay,
so the really important thing is do not reduce your interactions with your healthcare staff, because we know from the first wave and from last year in particular, or this last year in particular, that a lot of patients have been presenting very unwell. They've been presenting late, and it's partly because of what you've described, patients slightly reluctant to maybe engage with a GP or having difficulties engaging with a GP, maybe not phoning us, maybe not being as insistent as they would have been a couple of years ago about getting seen. And we've seen a lot of really sick people, people who should have been caught earlier. So although I'm saying be dead cautious, don't take that into your interactions with the healthcare service. The healthcare service should still be seamless for you. It should still be able to pick you up if there's any problems, and so be, and if anything, go the other direction. Engage more with your PH team, for example, over this period, because you might find face-to-face goes down a little bit again in this next few months. Our feeling, and I don't have data to back this up, but I'd be interested in your opinion, is that the move to kind of decentralized or telephone calls and video calls works really well for stable patients, but not well for unstable patients. And so if you've got questions at the back of your mind about the stability of your pulmonary hypertension, if you're worried about it, don't sit there with that worry. Pass that worry on to the healthcare team. And I'm pretty certain that all of the rest of the centres function like your centre does and our centre does, and that is that we always have somebody you can call. So if you have difficulty getting hold of your primary care, then you call us. And if we don't need to do anything, we will be quite relaxed about taking those calls.
And I think, I agree, Mark. I think that is the case if you're stable. But sometimes not knowing if you're stable is one thing, but it's going from the norm to something else, and that's the bit to take it. And one of the benefits of picking up the phone and at least having that conversation is that you're not creating more work. You're probably preventing lots of extra work, things like that. So, it is interesting, the impact survey, which I know you might have seen some of the data there, and you're still sort of analysing it, that the PH population themselves felt really well supported by the specialist centres, and to have that confidence. And as you say, don't disconnect. Don't feel as though they're really, really busy, so I can't ask about this. If something's out of the norm for you, then to make that contact is really important.
Yeah, and I second that. We are open for business.
Yeah,
and in fact, we know how to do this now. Maybe the first wave it was a little bit less coordinated, but we've been doing it for a year and a half, and our service should function exactly as it did before, and I'm pretty confident saying that for the rest of the services around about the country. So we are not, failing. The PH services around the country are ready and coping perfectly fine. You just need to call us, or you just need to get in touch with us if you think we've got problems.
And again, I think it's we keep mentioning about doing the basics really well in this, particularly in the holiday period, of ensuring you've got all your medicines, you take them regularly, because remaining really fit and well is really important at a time like this. So doing the normal, doing the basic stuff is really well, making sure you got the medicines. I think, I probably the same as me, Mark. I know quite a few PH patients that have had COVID and actually recovered quite well from it. But the well treated, the ones that have done really well. Now, we didn't know this at the beginning of the pandemic, and this is not to lessen the risk, but I think it demonstrates the well treated individual with any chronic condition, but particularly PH, maintaining your medicines and checking everything's okay is really important.
I agree with that, and actually, I was pleasantly surprised in the last year and a half that COVID hasn't had the outsized impact that we were all worried about in our community. But that doesn't mean that they're safe, and so I think that when looking at what the risks are, the patient with pulmonary hypertension can be at least confident that they're not top of the list, but should probably just be a wee bit more cautious than that average person who has no health problems standing next to them. And so I think we've got one wave to get through here, and so take a cautious approach. But I agree with you. Actually, I've been quite heartened by a number of the patients that got COVID and coped with it. But like you say, usually it's because they were stable.
Yeah, and it's not to diminish the impact of COVID, because it still impacts people really hard. But it's just to say that well treated, etc., is just and being as healthy as we can be is really important. So, Mark, I know time is of the essence, and we might even be speaking in the new year again to see how things pan out. It's really helpful. I think it's been good advice. Weigh up the risk and do all these. Assess every situation as it is. And I agree with you. Decide, know who you're going to be meeting at this time, particularly with PH. Know about these people that you're going to be meeting. Don't just assume. And we're investing in the short term for the long term, and it feels really heavy because it seems to be going on for so long. It's another Christmas. We thought we were nearly over the hump, and it's come along at a really difficult time.
Yeah, I agree with that completely, and so I'm not being dogmatic. I don't think about advice. You know, there is some colour in there that there is, I think, going to be variation in what people do, but think very, very deeply about what your individual risk is and how much risk you're prepared to put yourself and the people around about you as you make your plans over the Christmas period. I mean, I think bunkering down and having some terrible mince pies and arguing with your people in your house, that's what we do normally at Christmas. So actually, you know, in some ways, Christmas should be a pretty easy time to hide away from the world for a few weeks and wait and see how things pan out. But the advice from the government may change again, but I don't think it will change that core advice that we're giving out today.
Yeah, great. Okay then, Mark. So we're really hopeful you have a good Christmas, whatever you do. I really hope you do get to see your dad, because I know it's been a really difficult time and things like that. And there is the bit that we can't really articulate, the mental, the thing about being human, about meeting people that we know and love, but it's just a really challenging time, and just be open to the advice. But I do hope you get there. You deserve it.